Hello and welcome, viewers from around the world. I'm Kristen Schwartz, licensed midwife and one of the MCs here at GOLD Learning and GOLD Lactation. And here with me today is Dr. Aruna Savur. Welcome, Dr. Savur. It's nice to have you here.
Thank you, Christine.
We here at GOLD are getting ready for our GOLD Lactation Online Conference, and you, Dr. Aruna Savur, are part of our add-on package that is titled A Whole Body Approach to the Clinical Management of Complex Breastfeeding Issues. And I want to get to that in just a little bit, but before we get there, first of all, where in the world are you located? Where in the world are you coming to us from?
I'm in Bangalore, India.
Beautiful. And you have been working in breastfeeding for a long, long time in the world of lactation. You're also a pediatrician.
Yes.
Tell our viewers a little bit about your background and what your practice looks like today or in this, time.
Okay. So I started off as a pediatrician in private practice, and then I trained in neonatology, and I worked in a couple of NICUs where I found that there was fantastic support, clinical support given to the babies, but the mothers or the parents were, not supported so much. As a pediatrician, my education and breastfeeding support I found rather lacking. So I did some training, and then I, passed the IBCLC exam, and I've been educating myself further on a lot of topics related to holistic breastfeeding support. And I find it immensely gratifying and humbling to be part of the breastfeeding journeys for so many families. And it's, it's really wonderful when I'm able to help them to achieve, whatever their dreams and hopes are.
Wonderful. Well, thank you so much for sharing that and your amazing work there in the community you're serving there. You mentioned that in your training as a pediatrician and your journey there, that breastfeeding knowledge or was very limited in what you gained there during and you had to kind of really do all this by yourself and extra trainings and extra certifications, correct?
Yes, yes.
Do you see there is a movement maybe coming up in your area that maybe it is considered more to have that education now as part of the knowledge and skill level being taught to new pediatricians, or do you still see that today that everybody has to learn for themselves and add?
Yes, I don't think the curriculum has changed so much. I think in all the colleges, it's just a chapter in a book, or maybe it's a very cursory advice that you would give a parent, but not so much support. If as pediatricians, we really feel the need to support a family better, I think it's up to us to get that education. That is still the norm here.
That's still the norm, yes. And you mentioned you worked also in the NICU for a while with neonates there. And it is wonderful that you're able to support families in the NICU with breastfeeding and giving the little ones human milk. What have you noticed there in your time there?
So it's a period of great stress to the NICU families. That is the first thing that strikes me. And there's so much anxiety around the well-being of the child, and also the onus on the parent, the mother, to produce enough breast milk. I remember a particular incident when I was working in an NICU where the mothers were supposed to go to a pumping room, pump the milk, and come give it to the staff in charge of the baby. So this particular mother was not able to pull out that much milk, so she has taken someone else's milk from the fridge and given it to the staff, and that was cold milk. And instead of supporting her and meeting her where she was, there was a kind of a shaming, questioning done, and I found that really upsetting. So that is one of my major memories from the NICU, and maybe one of the reasons why I felt I need to educate myself so that I can support mothers like her better.
That you support mothers better. That's thank you for sharing that. That sounds like a very difficult situation there for that particular family and the baby there as well. And what I love about how you approach this field is you are looking at this from a holistic standpoint. You have shared that you have many additional certifications. Now you're going also for certification in craniosacral therapy for babies, right? So tell us a little bit how you came to this, that you wanted to a more holistic approach than just a pure medical approach.
It happened when I met another IBCLC here, and she is a holistic IBCLC. I was very impressed about how she was able to treat babies, about the kind of caring and the space that she was able to give. And that was really inspiring for me. And I know that she uses a lot of Bach flower remedy, she uses homeopathy, and she's also a very experienced craniosacral therapist. So I'm making some effort to walk in her footsteps and maybe get training myself so that I can help these little ones as much as I can. It's not every parent who comes to me who has the capability or, the mind space to go to the various people or the experts that I would refer them to. So if I could do a little bit on my own to help the baby on their way to competent breastfeeding, I think that would be ideal.
Well, that sounds absolutely beautiful, Dr. Aruna. Let's talk about your presentation now. Your presentation here is titled Form and Function, Looking for Clues in Babies with Structural Issues Affecting Breastfeeding. What are these structural issues? Talk a little bit about that first.
Yeah, so I likened the whole breastfeeding to an orchestra and the different sections in the orchestra. So if you think of it like that, it would be factors affecting the muscles, the bones, maybe some issues in the nervous system, and most importantly, the primitive reflexes and the supportive systems like, say, the respiratory system or the cardiovascular system. So where I practice, the most common structural issues I find are tethered oral tissues and torticollis. We also have a lot of respiratory problems like, say, laryngomalacia. And when I was working in the NICU, of course, I saw a lot of structural issues affecting the cardiovascular system or, the tracheoesophageal fistula and systems like that.
Yeah. And I like your title, how you, as your title is Looking for Clues in Babies. It's almost like a little bit of detective work you have to do there, looking at each baby, each dyad, each parent together and seeing really what's going on there, right?
Yes.
Absolutely.
Yeah, that's true.
Absolutely. So tell us a little bit of what we can look forward to in this presentation.
So when a parent comes to you with breastfeeding difficulties, I think the kind of response one would have is to try to iron out those difficulties and to work on the position and latch and make the mother breastfeed as well as she can. But sometimes the kind of help you need to give the baby goes beyond that, which is why you need to look at the whole body of the baby to see how they're moving, to look for restrictions and to address those particular, restrictions or the compensations that are happening there. And once you work on those compensations, then the breastfeeding becomes easier. So I've met mothers who have been supported very traditionally with just the position and latch, but still after a couple of months are still struggling with the breastfeeding journey. And then you examine the baby and then you find a whole gamut of structural issues. So unless you address them, it is never going to a state of competence.
Right, because these structural issues don't usually resolve by itself. They need some assistance there as well. Exactly. Perfect. Yeah. Well, thank you so much for sharing that. Before I let you go, Dr. Aruna Savur, any last words for us here? A little nugget of wisdom for our viewers.
I just want to thank Gold Learning because it's been so much a part of my journey as an IBCLC. And I really love the speakers that you bring on. So, it's been a real honor to be here today. And in preparing for this presentation, I developed so much insight, actually. So it's been an education for me also.
Well, thank you so much for sharing that and your kind words here for us today, Dr. Aruna. And now some information for our viewers here today. This package, the whole body approach to the clinical management of complex breastfeeding issues, is a lecture pack that will be available on April 3rd. That is currently an add-on package to our GOLD Lactation Online Conference of 2023. And we will get started with that conference also on April 3rd with a keynote presentation that is open access. So make sure you check out goldlactation.com for all the information on all the presentations in the conference and also, of course, in that lecture pack where Dr. Aruna is a part of. Okay, thank you, Dr. Aruna Savur, for sitting down here with me and talking about the amazing work you're doing here in the community.
Thank you, Christine. Thank you, Christine. It was wonderful being here with you.
And thank you to all of our viewers here that participated with us and watched this little interview here. And we hope to see you at the conference and also to check out that wonderful package that we have here available for you. Bye-bye, everyone.
Bye.